Hi, everybody. I'm Phil Klein, and I'm here with a very special guest. Today, we have Steve Davis, who's the former CEO and president of PATH, the Seattle-based global health nonprofit, who has been doing extraordinary work with the WHO and with many other organizations, both in the Seattle area and then more broadly across the US and internationally. So welcome, Steve. Thank you so much for taking the time to join us. How are you, and how are you doing in these very strange days of COVID-19?
Well, these are strange days, that's for sure. But I'm doing very well. Thanks for asking, and have been lucky to be out at our place on Bainbridge, so I can take walks on the beach between many Zoom calls. But it's fine.
Glad to hear it. Yes, so thank you for that, and I'm glad things are going reasonably well. As you know, you may imagine, we've all been wondering, like, what's going on in these bigger layers of the situation, in the government and across businesses, and dealing with this as a digital pandemic of sort. I think you've called this a phenomenal digital pandemic. Can you describe a little bit about what you mean by that and what kind of shape that takes for you?
Yeah, so I've been involved in a lot in COVID since the early part of the year. I was part of a large commission on national health security, so had started talking about the pandemic, the issues around pandemic and outbreaks for quite a while over the last several years, and worked on Ebola in Africa and other things, and then certainly as this epidemic and then pandemic started to emerge, started to engage globally, but also been quite focused locally as a member of Challenge Seattle, the business leadership group that has been very focused on helping the regional response. But with both of those perspectives, and particularly at the global level, I've focused a lot on the digital piece. It's mainly because I am co-chair of the World Health Organization's Digital Health Technical Advisory Group. And in that role, I've been asked by Dr. Tedros of WHO, actually to Geneva, although I'm happy I decided to stay on Bainbridge for a while, but to help with the response. And it's an amazing response in many ways. So, I mean, beyond health, certainly look at all of us living our lives on Zoom, or, streaming Netflix, or finding out ways to communicate, educate, and do almost everything virtually. So I think it's sort of the first real global crisis, if you will, that happened in a fully digital model. But in health, it's particularly apparent. I mean, there's not many people that around the world who have any kind of access to internet or news that don't know what flattening the curve looks like. And that's all about digital analytics and visualization and analytics. And we have telehealth apps and programs that are being developed up to test, to trace, to chain, to model, to synthesize. And so it's quite extraordinary, I think, the amount of enthusiasm, some really smart things that are happening digitally. Obviously does not mitigate the challenges of this horrible epidemic or pandemic, but it's a very revolutionary time digitally.
Can you share some examples of way digital tools are specifically being applied to help process knowledge and information?
Yeah, I mean, let me tell you, the obvious one outside of health specifically, but I think we've just probably seen about 10 years of acceleration on digital online education. And I teach at Stanford, and I just actually hung up from my virtual class with a number of with about 40 students, and most of us are talking in the academic world about what probably would have taken us another 5 to 10 years to actually do and adjust and manage. We've all been forced to, and so that we're not going to go backwards from that. I mean, we may hopefully go back into classrooms for sure, but I think we'll all be much more adept. And that's happening, in retail, as we see stores transfer their brick and mortar stores to online distribution centers, and like Nordstrom's doing with some of their stores and things. So I think there's a broad context. In health, Let me give you a couple of examples. First of all, the ability to use digital visualization has really helped us understand this pandemic, both its hotspots and its curve, and also getting a better sense of what the variabilities are city by city and country by country. We're actually using a lot of interesting tools now to track, so patients or citizens can understand better what's going on in their community, what's going on in terms of movement of the pandemic, and actually how to themselves in their home, how to know when to go to the doctor. That kind of a tool is available in many forms. It's quite amazing. Of course, now as we enter contact tracing, this phase where in order to reopen economies and go back to work, we need to be able to effectively make sure that we're still suppressing the virus, and as a result, we need to do very aggressive testing and contact tracing and sort of wraparound services around that, including if people have to be quarantined, what is the medical and social support they're going to get. And we are seeing some very interesting tools, everything from ways that health workers can be monitoring and managing that to mental health and other capabilities being provided through online, through interesting, of course, Bluetooth and GPS enabled tools to enable people to even understand if they've been within a few feet of somebody that might have been exposed to the virus. So, you know, a lot of these are still in development. There's a lot of ethical and issues around some of them, but it's still a very robust opportunity.
And when you think about the kind of coordination and the coherence and you know, dealing with a very fragmented in some ways environment, because it's so dynamic and it's changing, and this acceleration is happening within a, you know, a pivot and within all these, you know, complex changes that people are struggling to adapt to, even as they may need to sort of change to go into the next phase. You seem to have an attitude a little bit more like, hey, this is a transformation that's happening, and it's more than just a disruption and, you know, scattering all the pieces, that things are assembling and reassembling. Can you share a little bit about, you know, how you see this coordination and this coherence being, you know, found, particularly as, you know, we thought we would be kind of flattening the curve, and then what is this potential additional second hump? Or, you know, how do you help kind of reach towards that sense of coherence and coordination?
That's a really great point. And let me underscore, I do, while there is an opportunity to not let the crisis go wasted and take advantage of some of these digital transformations, by no means am I saying it's not wildly tragic and disruptive, and minimizing the amount of confusion and pain and grief and suffering. But I do think that there will be transformation that comes out of this, and I think we're starting to even see evidence of it. But to your really important point, it's symbiotic, and even if one takes, I mean, the whole situation is chaotic. Not clear what this sort of mystery virus is doing in many instances. Various approaches and communications, and variations across the world and across the country on how people and countries and politicians are adapting. So it's quite chaotic, and in the digital world, I would say that's especially true. So in some ways, we are seeing almost a luxury problem occur, where so many people are stepping up and volunteering with really good intentions to help out and offer up their ideas, their applications, their capacity, that we're actually have almost, I mean, I hate to say too much, but it's somewhat coordinated. There's a lot of reinvention of the wheel over and over, and a lot of confusion, actually. So one of the things that we're hoping to do, and certainly it's been a role that I've been trying to help shape and support at WHO, but also we've talked about it with various leaders nationally and locally, is have more of a clearinghouse approach to some of these ideas. So at WHO, we've actually have mounted an effort to say, what are some of the best digital tools across the wide range of the pandemic, you know, from AI for research for a next generation vaccine, or a vaccine or a next generation therapeutic, to patient facing tools, to supply chain tools, to all these different kinds of tools, and say, you know, what's available, what's been used by whom. And so particularly member state African countries and countries that are sort of at the earlier stages of the pandemic don't have to go and figure it all out themselves. Right now, we've done some interesting research to learn that a lot of countries are going to Twitter to learn tools to use, and so try to make it more a better tool, a more informed approach with more valid data on what's working and what hasn't worked. So I think there's some good approaches that we can start deploying on sort of these clearinghouse models, and this is not the only one. There are many different forms of that. And there's also, I think, an important step that we're taking globally and nationally is to, instead of just saying what are people able to do to help, which is great, but it's actually flipping the question to say, what do we need? What are the gaps? What's the real challenge here? And so once we define sort of those cases, it's easier to go and ask big companies and small companies or volunteers or hackers or whatever you're looking for to help you solve that. And we have needs. There is still a lack of coherence on, you know, supply chain rules and management around PPEs, particularly as you go into other parts of the world now. There's great confusion on, you know, how do we track and trace and manage particularly asymptomatic patients as people go back to work, and what is the better way to connect those dots. And you know, we've got a lot of questions that still need to be solved, and hopefully between policy and good public health practice, but also some digital tools, we'll be able to figure those out.
Wow. So you know, the way you're articulating it is like a business problem in a number of ways. You know, how do you get things from point A to point B and negotiate and you know, make those supply chains work? Are you seeing traction in terms of you know, improving the coherence, the connectivity across the different parts? You know, there's a bit of a frenzied atmosphere, I think, when it comes to talk about you know, what needs to happen, and so many obstacles in place to try and get things done. Can you share a little bit about what does a coherent response start to look like, and are you seeing some signs that it's taking shape, or that we're still it's too early to even know if we could get out of this chaotic orientation?
Well, I was accused appropriately of using mixed metaphors and mixed sports metaphors, which is even a worse offense apparently, around this, and not about COVID, but about Ebola a few years ago at Davos, where I said, you know, it's like a 5-year soccer game where everybody's facing the ball, and then, you know, we're all in. I mean, we forgot that there's any other disease in the world right now but COVID, and we're all facing it. But then it turns into a big scrum because you know, once everybody gets the ball, they're jump in, and it takes 6 months to figure out who actually ball and piece it out. And I think we're kind of coming out of the scrum stage on this one, that we've so you know, I would say it is frenzied, and kind of depending on the week or the top, you know, I'm not sometimes sure whether we're in the 2-step forward or the 1-step backwards phase, but we are beginning to see some you know, first of all, some amazing effort by amazing, talented people around the world, activists, committed scientists, clear-headed politicians, and others who are saying, we, you know, been taking it very seriously and working very, very hard. I cannot tell you how hard, you know, some of the, not just the frontline health workers, of course, and frontline workers of all types, but also people who are in this horrible role of having to be responsible for making these tough decisions. You know, public health and world economy, economic growth, and or well-being. So those are tough things to I think we're also beginning to break the, kind of, I say this at a global level, break it into its more manageable chunks, and then figure out how to test those. And so certainly now there's a large effort being mounted that will be a very complex effort, and there's a certain level of food fight going on around it, but around getting the global community toward a vaccine, which is sort of the end game here, at least as it's understood today. If we get a therapeutic or something, it might not be the only end game, but that's certain. So finally, we've sort of got people focused on it. There's a lot of studies out there, trials. At Path, we over one of the biggest portfolio of vaccines for the developing world. So it's a field and a set of relationships I'm very familiar with, and I feel that if we can pull this off, I mean, it's a very, very, very audacious idea that we could have a vaccine in a year or two, distributed to billions of people around the world. But I think there's a lot of people putting a lot of incredible focus on that. Coherence is beginning to shape. Now there's still the U.S. sort of playing its game versus what the Europeans are doing versus the Chinese. So there's a lot of challenges globally on how we'll manage this and how we'll coordinate it. But I do still feel like a lot of the right people are focused there. As it comes to country by country, to be blunt, I mean, the U.S. is a bit of an outlier. Not to say that we haven't seen other countries with, staggering cases. Certainly the U.K. and Italy have also seen, kind of a dramatic. Their pandemic is quite different than others, but we've been. Probably have less of a clear national plan. Obviously, is even today the CDC's plan, who runs these things, is not being adopted or been rejected by the White. It more confusion, I would say. And I say this as not just an American, but I say this really more from the global perspective that I'm spending most of my time on. The U.S. is strong, among the most in terms of getting a response in place, getting equipped to the people that need it, having the policies clarified early. We've got into quite a fight over the PPEs, and that's still going on. But where I was quite involved in helping get some piece supplies in the early stages, and literally kind of thing where you would have thought you kind of had a deal. You got outbidded by another state or by the government at the port in where they had, and so that kind of stuff shouldn't happen. That's not good management. So there are definitely things, but I think overall we're starting to see a rational approach to getting therapeutics and vaccines available. Approach to understanding what it's going to take to test and contact tracing, manage as we go into this big stage of the pandemic where we're going to be back at work, but we're going to have to manage and suppress the virus. And we're starting to watch a lot of people understand the social changes that are necessary. While there are certainly very visible and a lot of concern about people that are kind of going against public health advice, the polling shows that by far the majority of Americans are following good, following social distancing rules, wearing masks, etc. So I think that's a significant and positive sign that we have the majority of people sort of doing the right thing.